Hi, and welcome to Crawley Wellbeing. My name is Sally-Ann Pluck, and I'm going to be talking to you today for the Nutritional talk about cholesterol. This is an important subject because high levels of cholesterol can increase the risk of heart disease and stroke. But there's some simple things that we can do to bring the cholesterol down and to a healthy level, like eating better and some forms of exercise. So just to explain, we're going to talk about what cholesterol is, different types of fats, saturated and unsaturated fats, and then types of foods that contain these different types of fats and what we can do to reduce our cholesterol levels. So cholesterol is a fatty substance in our blood which is produced naturally in our liver. In fact, our liver makes about 95% of cholesterol. And everyone has cholesterol. It's really needed. It's an important component. We need it to stay healthy because every cell in our body does use it. Major components of all cell membrane is used to make essential molecules such as hormones, fat-soluble vitamins, and it helps the bile acids to break down your food. So there's two major types of cholesterol. So if you've had a blood test, cholesterol blood test, it might show on the breakdown of your lipids, LDL or HDL or triglycerides. So I'm just going to quickly explain what these are because it's very important to know your numbers. Total cholesterol, healthy cholesterol should be 5 or below. Anything above that, the doctor or nurse might discuss to you ways of reducing your cholesterol. So LDL is known sometimes as the bad cholesterol, and having too much of the bad cholesterol can cause problems because it can clog up your arteries, the major blood vessels that carry the blood to the organs. If these arteries that carry the blood to your heart get damaged or clogged, this is what can lead to a heart attack. If this happens in the arteries that carry the blood to your brain, then this can cause a stroke. So it's important to understand too much of bad cholesterol. So if you have too much of the bad cholesterol, the LDL, and it gets stuck in the walls of your arteries, this makes it harder for the blood to flow through, which can cause a heart attack or a stroke. So it's when we look at the types of cholesterol, we have to look at lifestyle habits, and we can reduce the LDL by reducing the amount of saturated fats that we eat. So how can we control this? So we can control it by looking at the types of foods and looking at food labels and looking at where you're getting your saturated fats from. So if you're looking at a food label and it has the red traffic light signal, so saturated fats, then that's something that it'd be worth avoiding, and that will help reduce your cholesterol levels. So the saturated fats that you find can be in things like animal products, meats, butters, milks, and lots of processed foods as well, like cakes, biscuits, even takeaway foods can contain a lot of saturated fats that you might not be aware of. Other things you can control is smoking, your activity levels, and having too much fat, especially around your middle. Things that you can't help with cholesterol is as we get older, our bodies tend to find it more difficult to get rid of LDL cholesterol, different ethnic backgrounds, and a family history. So how do we get our cholesterols down? So we can reduce the conditions of high cholesterol by looking at the things that we eat, reducing alcohol, being more active, and stopping smoking. So when we look at the foods that contain high saturated fats, these are mainly in, like I mentioned before, butter, fatty meats, cheese, cakes, biscuits. So swapping those foods for unsaturated fats like olive oil, nuts and seeds, oily fish will help change that balance of LDL, which is the bad cholesterol, to HDL, which helps remove the bad LDL out of your system, and it helps clean those arteries. So doing those healthy swaps. So for example, with animal products, especially milk and butter. You could look at, instead of full fat milk, skimmed milk or semi-skimmed milk. And with butter, just use butter sparingly or go for some low fat options. With meats, there are different products which have lower fat. They've taken some of the fat away. So for sausages or mincemeat, they might remove some of the fat from those products. So again, look at the food labelling. And with meats that have fatty layers like bacon or chops, you can actually take some of that excess fat, actually remove it from that product. So it is really important to look at the food labels and try and choose green or amber when it comes to saturated fats. And moving more, it's really, really important. Increasing the amount you exercise and do some form of activity strengthens your heart and reduces the bad cholesterol. Being active helps also raise your HDL while helping your body move the bad LDL out of your system. You don't have to use a gym, but it's just changing certain things, making small changes, like instead of taking the lift, you can take the stairs. When you go for a walk, try and make it more of a brisk walk. So there are a couple of things that are really important that you can change and you have more control over. So another point that I'd like to make is with other types of foods like meats and pies and cheeses, hard cheese, soft cheese, these types of fats, these types of foods can also contain hydrogenated fats. So it's important, again, these are quite dangerous fats, and a lot of food manufacturers are trying to take these types of fats out of our food. So again, look at food labels. Unsaturated fats are fats like monounsaturated fats, polyunsaturated fats such as avocado, different types of oils like olive oil, rapeseed oil, walnut oil, nuts and seeds. These all contain healthy fats that, as I mentioned before, can help reduce the LDL in your system. You might have heard about eggs. Eggs is one of those products that people can associate with cholesterol or high cholesterol. Eggs are a really good source of protein and contain lots of vitamins and minerals. There's no recommendation limit on how many eggs you should eat, but as long as you have a balanced diet, you can still include eggs, even though the yolk is where it carries the actual saturated fat part of that product. There's also some products designed to lower cholesterol. These contain sterols and stanols, and they're developed specially for lowering cholesterol. These foods are aimed at people who have high cholesterol. So if you have not been recommended to eat them from your doctor and you haven't got high cholesterol, then these products should not be eaten. If you just stick to a healthy diet with fruit and veg and fibre and low saturated fat, this should be enough to control your cholesterol. The effects of lowering cholesterol with certain plant-based products, just normal Mediterranean diet, a rich source of fruit and vegetables, olive oil, lots of fish. This has been shown to reduce the LDL by about 10 to 15% when they have about 2 grams per day of healthy fruit and veg and fibre. So this is an important part of people's diet, and it's just a natural part of your diet and can help reduce your cholesterol. So when does high blood cholesterol levels matter? So we're looking at an average total cholesterol level of an adult in England is about 5.2. This has actually slowly fallen over the last 10 years, but it's important to get cholesterol levels down even further. So other major risk factors are smoking, having the high blood pressure anyway, not being physically active, being overweight or obese, having diabetes, and having a family history of coronary heart disease. Your overall risk of having a heart attack is much greater if you do have high cholesterol. So this is really important to get control of your cholesterol levels. So the benefits of losing weight: reducing risk of a heart attack, angina, stroke, and heart failure. Your BMI is one way of calculating these risk factors as well. So shape is another measure. Having too much weight around your middle can raise a risk of cardiovascular disease. Making small long-term changes such as portion control and activity has huge benefits on cholesterol and reducing the risk of heart disease. So some of the healthy dietary changes are to reduce saturated fats, include small portions of monosaturated fat. So these are fats that are liquid at room temperature, like olive oil and some of the vegetable oils. Eating foods in rich source of oily fats like salmon, mackerel, and nuts and seeds, olive oil and avocado. These also link to reducing the risk of raised blood pressure. So if you already have blood pressure, losing weight and making some healthy dietary choices can reduce your blood pressure. A healthy weight will definitely help reduce risks of developing raised blood pressure and help reduce your cholesterol levels. And reducing the risk of type 2 diabetes. In over 80% of cases of type 2 diabetes, they can be completely avoided by diet and exercise and controlling your weight. If you've already been diagnosed with type 2, you can still greatly reduce the health risks. Eating healthy choices, moving away from sugary snacks, cakes, biscuits, and soft drinks, and controlling your portion sizes is really, really important. If you have too much insulin in your system and the insulin is rising, this causes problems with your blood sugar levels. Pre and post operative, if you have a healthy weight, this is beneficial for patients waiting for surgery and also the recovery stages, and also reducing risk of developing some cancers. So losing weight may help reduce risk colon cancer, breast and gallbladder cancer. A healthy diet choice will include more fibre, so foods like oats and bran, whole grain, complex carbohydrates like whole grain pasta, whole grain rice, and vegetables, and just including a general Mediterranean diet of healthy oils, olive oils, and fruit and veg. These are everyday types of changes that you can control. So reducing the risk of raised cholesterol. So we know that saturated fats has an effect on your cholesterol levels. So just to reiterate on reducing saturated fats that are found in meats, pies, sausages and fatty meats, processed meats like salamis, and butter, lard, cakes and biscuits. By looking at food labels, really important to look at the traffic light system and looking at that saturated fat levels and trying to choose more of the green or amber choices of foods. And generally just making sure that you're staying active and you're looking at your portion sizes. And also it's really important to have a cholesterol check, and just to see, because it's one of those things that you don't necessarily know that you've got high cholesterol until you've had a blood test. So I hope this has been an interesting topic. Just remember, look at saturated fats, try and include more polyunsaturated fats, such as olive oil, avocados, nuts and seeds, and oily fish, and reducing portion sizes. Thank you very much for listening.